Coronavirus disease, COVID-19, is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission is to be well informed about the COVID-19 virus, the disease it causes, and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So it's important that you also practice respiratory etiquette, for example, by coughing into a flexed elbow. At this time, there are no specific vaccines or treatments for COVID-19. However, there are many ongoing clinical trials evaluating potential treatments. The World Health Organization will continue to provide updated information as soon as clinical findings become available. To prevent infection and to slow down transmission of COVID-19, do the following. Wash your hands regularly with soap and water, or clean them with alcohol-based rub. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that may weaken the lungs. And practice physical distancing by avoiding unnecessary travel and staying away from large groups of people. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. Most common symptoms are fever, a dry cough, and tiredness. Less common symptoms include aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on the skin or discoloration of fingers or toes. And the serious symptoms include difficulty breathing or shortness of breath, chest pain or pressure, loss of speech or movement. Seek immediate medical attention if you have serious symptoms. Always call before visiting your doctor or health facility. People with mild symptoms who are otherwise healthy should manage their symptoms at home. On average, it takes 5 to 6 days for when someone is infected with the virus for symptoms to show. However, it can take up to 14 days. Five new drugs are to be trialled in 30 hospitals across the country in the race to find a treatment for COVID-19, it has emerged. The 5 drugs which can be disclosed for the first time are heparin, a blood thinning drug used in hospitals up and down the country. It will be given to COVID-19 patients for the first time next month. In a number of conditions, it has been shown that if it is nebulized rather than injected, it can have a dramatic effect in the lung, said Dr. Wilkinson. It is a big sticky molecule which can attach to viruses and stop them from entering cells, and secondly, it may have an important anti-inflammatory effect. Tests of heparin will be highly anticipated because it is already widely used, shown to be widely tolerated, and it is naturally occurring and therefore can be produced cheaply in huge quantities if proven to be effective. bemcentinib, a tablet developed by the Norwegian company Bergenbio, which is used to treat blood disorders. It has been shown, almost by chance, to have a potent antiviral effect to reduce infection in experiments on a number of viruses, including Ebola and SARS coronavirus 2, said Wilkinson. It appears to work by preventing the virus infecting the cells, but also by reducing its replication within healthy cells by keeping the innate immunity created by type 1 interferon proteins active. Healthy cells usually switch off the entire machinery, so the virus can't hijack it, said Dr. Wilkinson. But COVID-19 subverts these, and this drug may help cells against viral attack, he added. Medi 3506, an anti-inflammatory injection being developed for skin disorders and chronic obstructive pulmonary disease, but which has also been used in trials for asthma by AstraZeneca. It acts to dampen down the cytokine storm that causes the immune system to go into overdrive and cause fever, inflammation, and fatigue. Calquence, another AstraZeneca drug used to treat mantle cell lymphoma. It acts as an inhibitor of the enzyme known as Brunton's tyrosine kinase, or BTK, and was developed for severe lung inflammation. It was chosen for a formal trial after anecdotal evidence showed a reduced incidence of complications from COVID infection or severe lung injuries. Zilucoplan, a drug developed by the Bergen Biopharma company UCB, which is already in trial for potential treatment of myasthenia gravis, a skeletal muscular disorder. Hopes center on its ability to stop the overactivation of complement cascades, part of the immune system that can kill cells and lead to catastrophic lung and tissue damage. A lot of the damage is focused on the blood cells and the very small blood cells in the lung. The drugs were chosen from a list of 200 potential candidates, and if they do not work for COVID-19, another batch will then be considered for trials. Should the trials deliver positive results, they will feed into the later phase national research programme being run by Oxford University.